articles published from January to November 2020. And this report presents a nuanced surfacing of women's context-specific needs and issues brought about by the current crisis, responses by states, and possible recommendations to mitigate effects of the pandemic, as well as to prepare for future humanitarian crisis. At the onset, we already knew that in times of crisis, like disease outbreaks, shown by studies of Ebola, SARS, Zika outbreaks, power relations alter and heighten the inequalities that women experience. So first, let's move to GBV, or gender-based violence. This has been called, next slide please. This has been called a shadow pandemic during the COVID-19 pandemic, but we know that it has long existed even before COVID. Gender-based violence happens, right? But what happened during the pandemic? Official report shows there is a decrease in the number. Very interesting. How come there is a decrease in number of gender-based violence experienced by women? In the police reports, there was a decrease, but there was an increase. Very interesting. There was an increase of online reporting or help-seeking behavior. People go online to search how to ask help. So clearly, cases were underreported, because during the pandemic, at least at the early part of the pandemic, there were mobility restrictions due to the hard lockdowns in different countries. And this was imposed by governments. Victim survivors, this meant that victim survivors were forced to stay at home with their perpetrators or abusers. There's also a climate of fear at home that keep victim survivors from seeking help in most cases. During the COVID-19 pandemic, there was also an increase in child early or forced marriage, which was seen as a way that gives girls' families financial relief in two ways, either by accepting of the dowry or by having one fewer family member to provide for. These are things that we needed to address. Online sexual abuse and exploitation of children, while it has been happening for a long time and has been pervasive in Asia, it was enabled by widespread poverty and ineffectual laws, is worsening during the pandemic, as restrictions on mobility drive sexual offenders to online spaces. From public offline spaces as our public spaces, we have now shifted online. So perpetrators, sexual offenders, maximize the online space. There were also reports of GBV in military checkpoints in some countries where women were intimidated or sexually harassed. So while GBV was not clearly a priority by most states' COVID response, there were efforts that were born from the impact of COVID on GBV, because there were news that this is a shadow pandemic, it has been happening, it has increased because of the pandemic. There were many efforts, mostly by women's rights organizations, to respond to GBV. In Indonesia, they created a mental health service for victim survivors. It's called Sejiwa. I'm not sure if I pronounced it correctly. In the Philippines, a volunteer-run online GBV support group called Luna's Collective was also introduced. There were various online campaigns, raising awareness, text or SMS campaigns, online reporting mechanisms for human rights violations, experience in checkpoints, and other online awareness raising campaigns. So we saw that online communities became vital resources. Online spaces are also, unfortunately, fertile ground for perpetration of violence against women, and even the rise of new forms of violence. It was enabled by online anonymity of perpetrators who also have access to tools for evading accountability. Online spaces have been crucial in providing support and resources for survivors, especially when mobility is restricted due to varying degrees of lockdown. So that is what we saw. Online space is now a pro and con. It has both pro and con. And we needed to navigate that during the pandemic. So in conclusion, the pandemic, for the most part, has shown the same trend. It was very similar to pre-pandemic, but perhaps even worse. But with much of the public's focus trained on preventing the spread of virus, we were all focused on how do we survive the virus? How do we find vaccines? How do we go back? Economy and all of that. GBV was clearly an issue that was sidelined, and we have to ensure that issues such as gender-based violence are not left behind. Perhaps the experience that we got from the COVID-19 pandemic, amplifying vulnerabilities such as gender-based violence, can be a launching point for awareness raising on GBV as a pandemic, which will hopefully draw out a sense of urgency among our duty bearers for an enhanced and better coordinated responses to the pandemic of gender-based violence. Next slide. For SRHR, we knew that epidemics aggravate existing inequalities for women and girls and other marginalized groups, as I mentioned earlier. But the lockdown measures have resulted in significant disruptions in essential service and supplies, delays and stoppage in information and service delivery, and it gravely impacted women's health and women's well-being. The lack of critical resources means increased rates in both teenage pregnancy and maternal mortality. There are researchers who estimated that the potential annual impact of a 10% proportional decline in the use of sexual and reproductive health care services resulting from COVID-19 related disruptions in 132 low and middle income countries is alarming, particularly for the well-being of women and girls, because the 10% decline in the use of contraceptives would result in more than 48 million additional women with an unmet need for modern contraceptives. So what were the efforts in response to this? There were, across 6 countries, there were provision of hygiene and dignity kits, including sanitary napkin in relief operations, again, led by women's rights organizations, civil society organizations. There were available services online consultations, and telemedicine for commodities, contraceptives, consultations, and needs. And there were also calls on government to provide commodities and services and include it as an integral part of the COVID response. And it is across the 6 countries. So the pandemic has limited access to information and services for adolescents, routine reproductive health services, contraceptive services, abortion services, and prenatal and postnatal care, among others. However, it is only symptomatic of a much deeper problem in place even before the pandemic. And take note of this trend of aggravating what is already a problem even before the pandemic. Social structures mediate access to and uptake of SRHR services. Our individual agencies, it is shaped by the dynamics between the cultural discourses on sexuality, which is imposed by structures such as the state, churches, mass media, and families. On top of that, we have patriarchal values and attitudes like social norms and negative views of family planning and comprehensive sexuality education, which impeded the access to SRH services. And as always, because the government put SRHR as into the sideline, NGOs and women leaders take up the slack, especially in delivering the services and information to vulnerable population. Lastly, care work or reproductive work, unpaid care work and reproductive work. Next slide, please. We know that this has been a problem even before the pandemic. Women are expected to do domestic chores on top of their actual work when they arrive from home. And when the pandemic emerged, the burden of performing the bulk of the domestic work significantly increased for women, because it is during a global health crisis that care becomes an important role and foundation of society. Because of the mobility restrictions, closure of schools, childcare services, and shift to work from home set up for non-essential workers, this has resulted in a majority of household members being confined within their homes. And the social reproductive sphere and the productive sphere collapsed into one. Now you have to work, your actual work, while taking care of everyone in the household. Even with family structures, with extended families inside the home, which we were hoping you will have more capacity to distribute domestic work, apparently, they still registered a significant increase in the amount of the unpaid care work to women. So even extended families, nuclear families, the burden is lies still on women. And even with the online classes, mostly mothers took on the role of educating their children, which is an emotional and financial burden, especially to poor families, in which there are parents who did not go beyond primary or secondary level of education. In Vietnam, economic participation of women has decreased because of the pandemic, resulting in their time stretched in the performance of household work and care responsibilities. But you know what is unique in the additional burden of being assigned to do care and reproductive work during a pandemic? The greater pressure on the part of women is to ensure that every member of the household is healthy. Part of this is additional layers of work from sanitizing all goods during the start of the pandemic, cleaning and disinfecting the house, purchasing medicine, constantly reminding everybody to drink their vitamins, sanitize themselves. Individuals at the lower end of the economic strata, particularly single parents and families, also experience the heaviest level of unpaid care work and domestic work. They have no one with them to do the brunt of the work. Even work from home employed married women find themselves torn between attending to their regular work meetings and meeting the care needs of their family. Even if there were studies that men were participating in reproductive work during the pandemic, the amount of unpaid care work that they engaged was not significant enough to unburden women. In the long run, this also might result in lower female labor force participation, or when married women search for employment, they might prefer less secure but more flexible work because of their responsibilities at home. So what are the initiatives? In India, there is a self-employed women's association who found a way to offload the unpaid care work of informal workers. They cook food and distribute the meals to families, helping not only the informal workers, but also generating income for themselves through the community work. There were relief operations to pull personal protective equipment and disinfecting and sanitizing products for frontline workers. Early opening in schools in Vietnam and Thailand eased the burden for mothers. And at the household level, we continue to negotiate, or at least attempt to negotiate, the distribution of unpaid care roles and domestic work to other family members. So, if you can see in the context of the pandemic, the nature of care work has added a layer of risk to the organized responses at the community and state level, combined with the collapse of the perceived division between the productive and reproductive spheres at the household level. It has compounded the burden that is faced by women and has further steeped them in time poverty, all of which is detrimental to women's economic participation and empowerment. And this is all just a consequence of a system that is for too long has pushed aside community care and social welfare in favor of individualized notion of self-care, self-improvement, and a deeper structural shift entails an examination of the systems that govern and define care and reproductive work, and a move towards viewing care as a broader social capacity and activity that both shapes and is shaped by social and power relations. So I'm going to end with my last slide. From this assessment of the impact of the COVID-19 on women and the corresponding responses of governments and civil society in the countries, several common threads of experience emerged. One is the interlocking nature of concerns under the thematic areas. Many aspects of these concerns have knock-on effects on each other. We know that these are very connected issues, and given this, a gender-responsive approach to the pandemic must employ a holistic approach, one that considers health and economics, but also take into account factors that may not be easily apparent or obvious. This goes beyond simply extending aid to women or providing them hygiene kits. What it calls for is an approach that is based on a holistic analysis and a nuanced understanding of the needs of specific sectors. We have to veer away, however, from one-size-fits-all response. Because we have an intersectional lens, we need to be clear on the differences in the impact of the pandemic across various sectors, which have different needs, resources, and context: women, persons with disability, rural women, older persons, and so on. The rest of the country remains at risk as long as one sector is vulnerable. And failing to adequately address this could have disastrous consequences, not just for the sector in question, but for the general population. This also means that we need to analyze and understand other factors that contribute to the situation of women and other marginalized sectors during the pandemic. The overlapping identities lead to varying degrees of oppression, and looking into other challenges experienced by countries during the pandemic, such as monsoons, flash floods, super typhoon, protests in Thailand, this all impact how our lives are during the pandemic because it's an added multiple and often overlapping challenges. And these are all entire constellation of external factors and other crises that may seem unrelated, but in fact mediate the impact of COVID-19. Remember that the COVID-19 response should be universal. Information, resources, services should be available to all across gender, race, ethnicity, etc. The pandemic has only been an aggravating factor. Responses are also determined by the political landscape as well as the broader social cultural context. I'm going to end last two parts. Sorry. Importance of women's leadership and participation. We saw how WROs, CSOs filled the gap in terms of delivering services, disseminating information and advocacy. And these are all laudable efforts. But women, again, must contend with added burdens and more unpaid work, which were found to have already increased because of the pandemic. It is important at the end of the day to emphasize the role and responsibility of our state, especially because they are the duty bearer. And they should have more impactful and sustainable if it's led by them. It's important to have a rights-based approach. It's all-encompassing, leaving no one behind, protection and fulfillment of all our rights. And finally, we have to rethink and reshape social norms and structures towards more equally inclusive and sustainable societies. This is an opportunity to build new, better, genuinely rights-based regimes around the world. And this is difficult. It is even more difficult for countries accustomed otherwise to start trying now in the context of COVID-19. The pandemic brought us unprecedented disruption and upheaval, but as this study underscores, the total breakdown of service systems could create a blank state for building back better. So we have that opportunity and let us use it. I'm going to end there. Thank you. I'm sorry I think I spent more than 15 minutes.
Yes. Thanks, Shabana. It's very thorough study and it's really catching the reality during the pandemic for the women. So the next speaker would be Verna. I will give you 10 minutes, Verna, please.
I'll not be very long. So this is just a contribution into the discussion that Shivana has already comprehensively tackled. Why is that working? It's working. So I did a study, a report at the height of the pandemic for the Commission on Human Rights, and I submitted it in February 2021. But due to the lockdowns, all the data were carried through desktop research and online discussions. And the report was entitled The Bearing of COVID-19 Pandemic on Women vis-a-vis on the achievement of Sustainable Goals number 5, which is to achieve gender equality for women and girls. Yes, next. So it's very short, and then we have already seen and mentioned in the past sessions that the pandemic has affected and has many lives, but for women especially, the pandemic has shown 3 areas where women and girls are particularly at risk, and I put this in the home, on the front lines of health care, and in the labor market. I shall not report everything in my paper, and these areas, based on my study, can be found along the dimensions of the economic, health, unpaid care work, and gender-based violence. Okay, next. So the virus pandemic has set back the target of gender equity to 257 years, as said by the United Nations and the World Economic Forum. Globally, structural gender inequality persists and has been also mentioned by Shibana. Namely, even before the pandemic, women earn 16% less than men, which is the gender gap. And women perform triple the amount of unpaid domestic labor as men. Women represent less than 40% of total global employment, and in the past sessions, this has been also mentioned or discussed. And women represent 57% of part-time workers, jobs that get cut during economic downturns. And these figures on gender inequality has worsened during the pandemic, being as a part of a crisis and an economic downturn. Yes, next. In my report, I analyzed the dimensions of vulnerability during the pandemic, and I shall discuss a few of them here. Next. Thanks, I. Basically, on the economic, which I really focus more, women bore the brunt of the economic pain brought about by the coronavirus pandemic. Why? The pandemic lockdowns, the shutdowns of schools, transportations, businesses, endangered women's livelihoods than men, because female job loss rates are about 1.8 higher than men. And this was in the middle of the pandemic. I think this has increased as the pandemic carried on for the next 2 years. The pandemic heavily affected economic sectors where women's employment was concentrated, such as restaurants, retail, hospitality, education, arts, recreation, and healthcare, which closed down during the pandemic. And the gender wage gap remained, wherein women earn just 79 cents for every dollar men make. This makes women particularly vulnerable economically and position in the labor market more precarious. And next. And at the front lines of health, globally, women comprise 70% of healthcare workers. And in some regions, women comprise 80% of nurses. And they were the ones really at risk of the virus infections. And for example, in the Philippines, the first ones that died were healthcare workers. And it was very high in the first few months of the pandemic. It was about 16% were healthcare workers because they were at the front lines, and vaccines and medicines were still not yet discovered during that time. And then during the pandemic, women's access to healthcare, particularly reproductive healthcare, have been drastically curtailed. And women also contribute to other service sectors, such as in social work, as civil servants, community volunteers in transport and logistics, facilitators, scientists, etc. And women's access to healthcare, like reproductive health, was that the hospitals during the pandemic would not accept non-COVID medical attention. So women's reproductive health were really curtailed at that time, and the clinics were closed. Women were endangered not only exposure to health risks at the front lines, but also not being able to access the healthcare system due to the lockdowns and limited services of hospitals for non-COVID patients. Next, And on the dimension of gender-based violence, I think Shibana has really explained a lot on this. But in the middle of the pandemic, the United Nations have issued a statement that the GBV has continued to plague women and has exacerbated during the pandemic, expressed in many forms such as domestic violence, sexual abuse, online harassment, child marriage, etc. In 2020, UN Women estimated that 243 million women and girls aged 17 to 49 have been subjected to sexual and or physical violence by an intimate partner in the last 12 months. This number was expected to rise during the pandemic as the lockdowns confined men and women inside cramped living spaces, heightening tensions with worries on security, health, and money issues. So the United Nations Development Program emphasized that gender-based violence increased during economic crisis, conflict, or disease outbreaks and exacerbates gender, economic, and social inequalities. Next. I also looked at the unpaid domestic and care work, and this is just to support what Shibana has mentioned, that women perform majority of unpaid care work than men pre-pandemic, and this has increased during the pandemic. So according to the International Labor Organization, women perform 76.2% of the total amount of unpaid care work, or over 3 times that done by men. In the Asia-Pacific region alone, a woman performs on average 262 minutes of unpaid care work each day, compared with a man's 64 minutes according to the OECD. So the lockdown policies or community quarantines during this pandemic has confined women in the home. It has increased the time for unpaid care work and other family responsibilities such as supervising the children's online learning and caring for the sick during the pandemic. Next. So what were the gendered responses based on the different literatures that I reviewed? In combination, first, the issues have to be looked at through a gendered lens. So some responses that were offered, like for example, ensure women's equal representation in planning and decision-making in times of crisis, wherein policies and plans to address crisis situations should not be coming down from the top, but should also be, women should have a voice in what their needs are to be addressed in times of crisis. And policy responses should target women and girls in all efforts to address the socioeconomic impact of the pandemic, including gender-based violence and access to justice, and drive the transformative change for equality by addressing the care economy, paid and unpaid. Interventions must also address the unequal burden of unpaid care and domestic work on women who usually bear the responsibility for caring for the elderly and ill family members during health emergencies. And lastly, to foster culture of gender equality, including zero tolerance of sexual harassment and sexual exploitation and abuse. And I think I'm almost finished, but these are just some of the specific ways or strategies, so how to get there. So in the dimensions that I mentioned in the home, integrate gender-based violence in national and subnational socio-economic response plans in times of crisis, provide coordination, support, and advice, adapt and expand services such as shelter, safe spaces, and essential housing along psychosocial support, and advice for individuals experiencing the risk of gender-based violence. And at the front lines, protecting women's health as they protect their families and communities' health, improve work conditions of women who are overrepresented in low-paid food production work, including in agriculture and grocery stores. In the labor market, some of the strategies should be to address inequalities in terms of access to social protection like health insurance, unemployment benefits, and other social protection for women who are most likely in precarious and informal work, and address the gender pay gap and workplace discrimination. And with that, I think that's the last. Thank you for your attention.
Thanks, Verna. We will go to Asadullah now.
The HDMI. There.
So thank you very much. I am Sadullah Mehman, Regional General Secretary of Pakistan Workers Federation. I just skipped some of my slides because already Sister Shabana and Varna told all such things. The situation is similarly in all countries, but in Pakistan is more worse condition in every flood or pandemic. So Pakistan has been hit hard by pandemic in sufficient medical capacity and unbalanced economic position has exerted the strain the crisis. So COVID-19 effect on women and girls simply by their gender in every sphere from health to economy, security to social protection, job loss in various sector, health issue and unavailability of social security coverage, no sickness benefits, no health benefits, no wage compensation. So working sector affected by pandemic, textile and garments especially in Pakistan, mostly women are working in textile. Home-based workers, more than 90% are women workers. Domestic workers, majority of domestic workers are female. And sanitation workers most affected as they were forced to work in vulnerable condition despite COVID. Private school teacher, mostly women teacher are employed by the private schools, agriculture workers and care workers. So this is a graph, you can see the blue is for male and the pink for female. So male are really affected, more affected than female. So social protection system help individual and families, especially the poor and vulnerable people and communities at the time of pandemic, crisis and shocks. During the time of pandemic or crisis, it is very difficult to find job, improve productivity, invest in health and education of their children. At the time, social protection works individual and families to support them in the time of the pandemic. But in Pakistan, we don't have social protection system for all citizens. Okay, so what we have social protection scheme for farmer workers in Pakistan. Farmer workers who is registered in these schemes. There are thousands of farmer workers. They are working in the establishment in multinational companies, but they are not registered with the social protection schemes. We have three major social protection schemes in Pakistan. Employees Social Security Institute, who provide medical benefits, sickness benefits, workers, children, education and other things. Another employees old age benefits, who provide old age pension, widow pension, survivor pension, and workers welfare fund, who provide housing scheme, death grant, marriage grant and education scholarship, etc. So international guideline also there, UN declaration and ILO convention on social security, ITUC AP resolution on social safety net. But despite Pakistan government is not providing such social benefits, such social scheme to every citizen. Like myself, I am not registered with any social scheme. If I ill, I want to pay myself, and if I get accident, I want to do all on my pocket. So government is not doing anything for their terms. So ILO convention also saying that Social Security Minimum Standard Convention 1952, Social Security Scheme, medical care, sickness benefit, unemployment benefit, old age benefits, employment injury benefits, family benefits, maternity benefits, invalidity benefits and survivor benefits. So in by pandemic recently, COVID-19, government provide 12,000 rupees cash grant for the poor workers, but they impose very strict like points. So farmer workers not benefited by this scheme. Informal workers they benefited, and relief in electricity bills, vaccination for all citizens, food packages, very limited for political scoring. So whenever we ask from the sector, in agriculture sector, they said we didn't receive any food package and any relief from the government. Still we have flood, but I myself around drive 900 kilometer area, meet with people, but they didn't. They say we didn't receive anything from the government, from the development sector. So no other relief, social protection provided by the state. So what we say, PWF definition of social safety net. Social safety nets are aimed at providing extended legal social protection, guarantee and social security to the most needing section of the society, particularly the working class and the social poor, as their human and social right, not only for their human and social objective in public policies and private participation, but as a system of international agreements, collective social contract and income redistribution. So old age benefits, employment insurance, unemployment cash benefits, retrenchment compensation. So my questions from participants: have social safety net been implemented in your country as defined by PWF? Like I present many things. What situation from your countries? Did you get it, this social benefits? I think are all sleeping now. So, public services. During the pandemic, government provided public services, health care services, vaccination by hospitals, isolation, free ambulance. So, for current situation, we have flood in Pakistan. The government is receiving a lot of aids from the international community, from Russia, Saudi, UAE, Nepal, Europe, and many countries, aids, food. But situation is that government is not providing such thing to the needy people. Okay, so we have representative in all provinces, in all districts. I ask many of our representative, please find any relief you receive by the government or by the NGO and give us pictures. They said we didn't see yet, but now they are saying that we started the survey, government saying. So on behalf of PWF and in collaboration with the ILO, International Organization, we started, can you share the screen? How can I share?
Only the PWF.
Huh?
Maybe the PPT, you can only share the PPT.
No, this is not PPC.
Yeah, it's
Can I share this screen, my screen?
Yes, whatever you play on your
Not playing there.
Did you put the duplicate? Yeah, duplicate. Yeah. the color.
Okay. So recently in flood, we started cash for work program for the agriculture workers, for the affected communities in Sindh. What we are doing? What happened? So we are giving cash for work program, like we hired more than 100 affected people from communities, and they are working in their own villages, on their own houses, and rebuilding their houses, their streets, and minor repair of the houses. And in the evening we are giving them 1,000 rupees, equal to, like if you count for a month, we will give them more than 1,000 rupees minimum wage. So these are some pictures. And these girls don't have school in village, and boys are allowed to go to school, and girls are not allowed to go to school. So we started a small tent school, and the federal minister, you can see, advised us to make a room for them and charge us. We will pay for that.
The minister?
Yeah, federal minister. Federal minister and ILO, OIC in charge, Pakistan. Okay, thank you. Thank you so much. Yeah.
Thanks, Asadullah. So I'll just go to Vivek for his presentation.
No, it's there.
It's there.
It's there. It's with you. Did you already? Turn on your duplicate. Duplicate.
Good afternoon, everyone. I'm glad to be here. First of all, let me thank the organizers for having us all here and being part of this wonderful discussion. So, I will be talking about the impact of pandemic on women. I will be talking about the impact of pandemic on women and the role of social protection and public services in the Indian context. And I think it has fairly been established by the speakers speaking before me that women were the ones who bore the brunt of the pandemic. Both the women in the workforce and women outside the workforce, the students and the working people and the housewives are what you call unpaid workers, unpaid women workers. I will just put for you some data from India that just before pandemic there were 24% women in the workforce, like they formed 24% of the workforce, and the female labor force participation stood at 1.8% just before the pandemic, which was already one of the lowest in the world. India is a very big country for just telling, and there existed one of the widest gender pay gaps in the world in India back then. That is at 28%, and we had a time use survey, not a very big survey, but we had a time use survey where it was found that women were spending at least 7 times more time from their daily life doing care work than their male counterparts. And then the pandemic hit, and as has been told, that women were more likely in India, twice more likely to lose their jobs as compared to men. And FLPR, female labor force participation rate, it went down to 18%, and the amount of unpaid care work also increased. Some smaller surveys, so it was around 10.5 hours per day unpaid care work for women, whereas for men it still stood at somewhere around 56 to 58 minutes. Amount of domestic violence, it also went up, and I think you can see on the screen I rate 40%. That is actually the number of support calls that the women helpline centers started getting. The domestic violence helpline centers started increased by 40%, and in some other countries and in some of the states the numbers went down. But actually, what happened was there was a break. They could not even reach